everybody, welcome back. Today I wanted to talk a little bit about interpreters and the role they fit within the healthcare encounter. So we've talked about the role of the interpreter, but really as a healthcare provider, how do you use an interpreter and what's the point of them being there? They speak the language of your patient and English as you do, but really what's the point? So an interpreter is another diagnostic tool, just like you check blood pressure, you listen to heart rate, lungs, look in the eyes, the nose, the ears. You have tools at your disposal to gauge the physical responses of the body. Well, with interpreting, your diagnostic interview is so critically important to the work being done. And an interpreter is a tool that you have available to you to go through that diagnostic interview. So diagnostics is the act of identifying a disease from its signs and symptoms. If you're not able to have a conversation with your patient, that's going to be really difficult to do. So oftentimes, interpreters will sense that you're rushed. And it seems like sometimes a provider thinks, okay, an interpreter's here, it's going to go quicker. Well, that's not actually what happens. What happens is you put an interpreter in a position where they feel like they need to adjust your message, filter your tone, build rapport, and do all of these other things in their head to make sure that communication goes smoothly. So an interpreter doesn't mean things go quicker, but it also doesn't mean that it has to slow down. A good interpreter will allow you to communicate at your pace with the words that you choose to speak to your patient and vice versa. So the technicality that you choose to share, an interpreter can and should be able to speak with the same technicality. However, are those the words that you would actually use to speak to a patient if I were your patient? Would you be using those same terms? So it isn't that an interpreter isn't qualified to speak at a high technical register, but it is your job as a healthcare provider to use the interpreter as your diagnostic tool. We could get into Google Translate and some of the electronic things and training and that topic, but really if you're thinking about interpreting as a diagnostic tool, I think it helps to reframe how you would work with one. Working alongside of the interpreter in a collaboration, you win. As a healthcare provider, that's your win because you get to see what a patient's willingness is to share their symptoms, to share their stories, to understand the treatment plan, to identify what their needs are. And that's what an interpreter is there for, is to collaborate with you in order for you to build rapport and understanding with your patient so that they're willing to divulge and share everything that's important for you to do your job. So when you're working with an interpreter and they're doing it well, you can watch for patients' body language, their expression, their tone, some of the underlying things that you look for based on their stories. When you're able to do that with your patient and make that connection, that interpreter has done their job. The interpreter isn't there to be the sole source of building the rapport because it's really about you being able to work with your patients regardless of the interpreter present. So when you're working with an interpreter, be sure to collaborate, be sure to focus on your patient. Interpreters can speak all of your technical terms, but it's really up to you to build that relationship. So if language is an issue, interpreters got your back, and that collaboration will help everybody win. If you liked the video, be sure to like, share, comment below, and we'll see you next time. Have a great day. Bye-bye.